Hi. So today I'm going to talk about being trained for before the intake, um, and during the intake for a mental health unit stay. So this video is really geared toward the providers in the units. So another term for intake, I guess, would be assessment, because when they get the call from the ER that there is a patient that might need to be admitted to the mental health unit, they had like a social worker or some mental health provider that works in the hospital will actually come to that specific part of the ER for those patients that might be admitted to the unit. So before intake, before you even meet the patient, ask the ER staff if the person had, or even just look at the chart to see if the person has a disability or might need accommodations while on the unit. During the intake and an assessment part of once you meet the patient, and talk to them, don't keep telling them when you're asking them questions that I don't want to re-traumatize you. You ask specific questions and they're trying to answer your questions. It makes it more traumatizing every time I hear a mental health provider in a hospital ER ask me a question and then tell me I don't want to traumatize you and cut me off, because I'm there to see if I'm going to be admitted and to get help. I'm not there just to say one brief thing about the question when it's more complicated than just one brief statement. So please listen to the patient during the assessment / intake part of the before they get admitted to the unit, and don't interrupt them. This goes for any patient, but especially for those with disabilities, because those with disabilities feel like that they've had to be silent, that they have been silenced their whole lives and haven't been able to speak up or tell their whole story. And that's very discouraging when you're going somewhere to try to get help and you agreed that you needed the help. And then you hear somebody ask a question and you're trying to answer it, and they're like, I don't want to traumatize you. But also included in the questions to the patient, do you have any disabilities? Like, what are we training the providers to ask that during the assessment / intake part of the visit to the hospital, to see if you agree that they need to be admitted or not. That way you know, like, that they have a disability going in when they're being admitted to the unit. And then you can tell the staff on the unit that this person has a disability. And these are the accommodations. Is different needs that they have while they're on the unit. Like, for example, well, with me, it would have been nice to have been able to have my teddy bear on the unit because of the comfort that he's brought me through tough times, and it's hard being away from him. Yes, I'm a 40-year-old female in the United States, but that doesn't mean I don't need accommodations just because I'm not in school anymore. I still need accommodations throughout my life. I still have disabilities. They didn't go away just because I became an adult. In fact, the disabilities might be making my life more difficult now that I'm an adult because I have to become an advocate for myself instead of having other people advocate for me or having set accommodations ahead, like set before the school year even starts. That made life so much easier growing up for me. Knowing that I already had accommodations set in place that I didn't have to ask for every year. As soon as I graduated high school, I had to give an accommodations letter to all my professors at the beginning of every semester, and that should not be needed. I know this is not mental health related, but in a sense it is, because we should, as the person with a disability, we shouldn't have to be the ones put in charge of remembering to tell the professors that we need accommodations. They should know what all accommodations are already. We shouldn't have to remember to give them an accommodation letter. They should have that provided by the school already. So it does cut into the mental health aspect because we might need to be starting therapy when we're in college. And or maybe we started before that, but it cuts into our mental health. It adds to it. The mental health problems we have. It makes the depression worse. It makes anxiety worse. It makes anything mental health related worse, especially having epilepsy and not knowing when the next seizure will be, not knowing where I will be when I have that next seizure, not knowing how long that next seizure will be, not knowing what that next seizure will look like, not knowing if I'm going to have to go to the hospital or the ER because of that seizure. So it just adds to my mental health problems. And we need grace during this intake process as people with disabilities, because we might process things differently or slower than the normal average person, which again, I don't like those awards, but that's not what this video is about. Another thing for during the intake is maybe have a patient advocate there or somebody be there with the person with disabilities during that process instead of sending whoever came in with them to the ER home and having them be there by themselves, waiting to see if they're being admitted or not, or waiting to see a mental health provider to see if they're being admitted or not. So have compassion on those that might have disabilities. Maybe that's one thing, is let somebody have whoever brought them to the ER be in that waiting room with them instead of sending that person home right away. And then, like, once it's decided whether or not the person's being admitted to the unit, then the person that brought them to the ER can be sent back home. They can go home whenever they want. The person that brought the person into the ER, the person that brought the patient to the ER. That way, there's flexibility there, and there's somebody that they might feel a little bit more comfortable with things being said, like while they're waiting around. It might make them feel more comfortable, or maybe just, like I said, a patient advocate. Maybe they wouldn't feel comfortable having the family member or the person that brought them into the ER around with them while they're waiting. So in that case, they need somebody else, a patient advocate or peer, somebody, anybody with them in that waiting area. Because otherwise, as I learned my first time around, I literally went crazy. Or I felt like I went crazy waiting around because I didn't. First, it took forever to get the person assessing me to come see me. And then it took forever to find out if I was being admitted or not. The second time around, it didn't take as long. I think it definitely depends on when you get there to the ER, how early in the day you get to the hospital. And that shouldn't matter, but like either. But I'm just saying, like, it's different at different times of the day, just like regular visits for physical health. One good thing though is, and it's unfortunate, but they literally seem to take people with mental health issues back earlier than other people. And that could be because of the state they're in, or like if they're being aggressive, or if like the depression or whatever they might be coming into the ER with. But assess the entire person, basically, not just the mental health part of the person. That is all the day, and I will see you tomorrow. Thanks. Bye.